ladies and gentlemen. My name is Anne Uluwakbo, and I would be glad to welcome you to today's webinar session. The capacity building session is organized by Plus-Circle Community Health Advancement Organization, and it's a weekly event. Plus-Circle Community Health Advancement Organization is a non-governmental organization committed to advancing school health, community health, and research. In previous events as this, we have dealt with topics such as how to frame your research question, statistical analysis, and fact-checking, among others. To catch up on the video recordings of the previous sessions, please check out the YouTube page. The link to our social media platforms will be shared shortly. We implore you to please follow us for more content. Participants are muted as they join to avoid distractions. In today's webinar session, we would be undertaking an introduction to secondary data analysis using an overview of the demographic and health survey. To deal with the subject matter, there is no other qualified person but Dr. Bright Opoku Ahinkorah. Dr. Bright Opoku Ahinkorah had a Doctor of Philosophy degree in Public Health, and he has had numerous transferable skills in scientific research, leadership, communication, and problem solving. He has high-level teaching and research experience in global health, with comprehensive knowledge in child and adolescent mental health, maternal and child health, men's health, and adolescent sexual and reproductive health. He possesses high level of expertise in implementation science, systematic reviews, and randomized control trials. In addition, he has excellent statistical analysis skills and experience working on both primary and secondary data. One of his achievements and his forte is the use of the demographic and health survey. Overall, he has published more than 300 articles in high-impact factor journals, and more than half of these articles are focused on demographic health survey. So, ladies and gentlemen, please welcome with me to today's webinar session, Dr. Bright Ahinkorah. Dr. Bright, over.
All right, thank you so much, Anu. Can you see me clearly?
Yes, we can.
Okay.
Yeah, we can see you clearly.
Okay. All right. So thank you so much for the introduction. I really appreciate that. And I think for today, because of the time duration, we are going to just have an overview of the DHS. And specifically, we are going to talk about the use of secondary data for analysis. So allow me to share my screen, and we would go as quickly as we can because you have limited time.
You're welcome.
Okay, all right. Okay, so welcome everyone to this session. I'm very glad to have you all listening to me. I'm surprised we are seeing over 100 participants, and I hope that at the end of my presentation, we would have enough time for everybody to ask questions, because as you are aware, the DHS is a very important data set that can be useful for us, especially those of us in low and middle income countries. But broadly speaking, when we talk about the use of secondary data, that is one of the things that a lot of people are now using, because from where I come from and from where a number of you come from, it's very difficult for us to get primary data for a number of reasons. It could be because of financial constraints. It could be because of time. It could be because of a lot of processes you need to go through in order to get primary data. So if there is secondary data that is already available within the field of health, I think it is worth it that all of us chance on it and make good use of it. And sometimes I get surprised when a lot of countries where DHS is collected, researchers, students, early career researchers, and even mid and late career researchers are not really making good use of that data set. We, as it were, need to bridge that research gap between us and those in the developed countries. That is the only thing we can do to improve our own countries. So sometimes you don't have to be there, and somebody from the global north will be using the secondary data that is collected from, let's say, Ghana or any other country. I don't think that is a right thing that should happen, because we know the context in which we live and we understand the data better compared to somebody who is in the global north. So I always encourage people that the DHS is one of the secondary data that you cannot really miss. You have to try as much as possible to know how to use the DHS. And like Anu introduced at the beginning, I have been working with the DHS for more than 10 years now. I have vast experience when it comes to the use of the DHS, because every time when there are new releases, we try to go through to see whether there are new things that need to be learned. So today, I hope that this overview section is going to really give you a fair idea about the DHS. Then if later, if there is another workshop that I need to come in to give you more understanding about the DHS, I would gladly make time for that. So for the outline of today's session, we are just going to look at the overview of the DHS, the various survey types, questionnaires, and manuals, analyzing the DHS data. And for this one, we are not really going to look at how to analyze it, but the steps that are involved in analyzing DHS data. There are some recode files that are associated with the DHS data. We are going to be introduced to that. And finally, there will be a conclusion on everything.
Hello, Dr. Bright.
So when we talk about the, okay.
Please, can you put your presentation in slideshow mode?
Oh, sorry.
Thank you.
Better now?
Perfect. Thank you.
Okay, thank you. So when we talk about the DHS, it is a secondary data that is organized by the DHS program, and it is funded by USAID. So they started collecting data on a lot of health indicators in low and middle income countries. The first DHS was conducted in 1984, and now we are in the 8th version. So the 8th version of the DHS is now available in some countries such as Ghana. And it has been conducted in over 90 countries. Initially, the focus of the DHS was on family planning and fertility, but because a lot of people became interested in the use of the data set, it has now been extended to look at other issues related to maternal and child health, as well as adult health. When we talk about the DHS, there are 4 major survey types in the DHS. So we have the standard demographic and health survey. We have the malaria indicator survey. We have the service provision assessment survey. And then we have the special survey, such as the maternal health survey. So these are all different types of surveys that are under the demographic and health survey. So it's not only one. A lot of people are familiar with the standard demographic and health survey, but there is also malaria indicator survey and then the SPA, as well as the special surveys, which you can also have a look at. With every data, as you are aware, before you collect any data, you need to develop a questionnaire, because we are talking about the collecting of primary data. So if you are collecting any primary data, you need a questionnaire. And because the DHS was also collected as a primary data before it became available to us as a secondary data, they also have standard questionnaires and manuals that are available for each survey that is collected. So currently with the DHS 8, you have the standard recode manual as well as the questionnaire. You all know what a questionnaire is. It has the set of questions that are asked of a participant. So the DHS goes through a lot of very comprehensive process in training people that are used to collect the data. So the data that is collected by the DHS is very accurate and reliable, because they use a standardized questionnaire. And for each country, the questions are almost similar, except the languages that will differ, because there are some countries that the data is collected in French, but in most countries, the data is collected in English, and they try as much as possible to make the questionnaire a very standardized one so that it can be used across multiple countries. When you want to analyze the DHS, these are some of the steps you can follow to do that. the first step for you to do is to select the surveys for your analysis. Like I mentioned earlier, we have about 4 survey types, either the SPA, the standard, the DHS, the malaria indicator survey, or the special one. So the question you need to ask yourself as step 1 is, which of the surveys I'm going to use? So you need to really understand whether you are going to use the standard, the DHS, the malaria indicator survey, or the SPA, or the special one, because each of these have their associated manuals and questionnaires you need to review. So this is a first step you can never miss. And once you are certain on the survey you are going to use, the next step is to review the questionnaires. This is important because you are not part of those who collected the data. So you need to really go through the questionnaires that were used to collect the data in order to really understand how the questions were asked, the skip patterns, some of the questions that some are not applicable to some participants. For instance, if in the questionnaire they ask something about contraception and somebody does not use contraception, there will be a skip pattern. So it will be not applicable for a particular individual who doesn't use contraception. So if you don't review the questionnaires, it becomes very difficult for you to really understand the data. So the second step, very important, look at the questionnaire that was used to collect that particular data and review that questionnaire. Once you have reviewed the questionnaire and understood all the questions, the responses, the skip patterns, the specific questions that are asked of specific individuals, the third step is for you to register for data set access. Very important. Even though the data set is free, is online, and you can have access to it, you need to register before you can gain access to it. This is part of the ethical principles or ethical expectations that are assigned or that are aligned with the use of the DHS. You need to really register to gain access to their data before you can have use of it. And the registration process is very simple. You just have to develop a concept note and you go in, sign in, put the concept note in there, and then just click register. Once you are done, within 48 hours, you have access to the data set through a link. They will give you a link and you would have access to the data set. Once you have registered and gotten approval to have access to the data, the next step, which is step 4, is to download the data sets. Usually the data comes in a zip folder and you just have to unzip it and you are done. Once you are finished with step 4, you move on to step 5, which is open your data set. These are normal things that I know anybody that is using secondary data or even any data set at all knows, but very, very important because you need to follow these steps in order for you to make good use of the DHS data. And after you have opened the data sets, the next step, which is very important, is to know your variables. The DHS has a lot of variables in the data sets, and each of the variables have their variable names and what they represent. Every variable also represents something, an indicator. You need to really understand each of the variables in the data set so that you don't use variables wrongly. I've seen people publish papers with the DHS, and sometimes the right variables they are supposed to use, they don't use them because probably they didn't follow this step 6. They did not really pay attention to the various variables in the data set before they started using that. After knowing your variables, the next step is to use sample weights. The DHS is collected over levels. So we have the sampling approach, we have the clusters, and within the clusters, we have individuals selected within the clusters. So you need to really know that the data set was collected within a particular time frame. And once the data set is collected at a certain level using certain sampling technique, there's the need for you to apply sample weights. And this is something you cannot do away with. And when you are applying the sample weight, you need to apply it correctly. There's a variable that is used to create sample weights for the DHS, V005. And you just have to divide V005 by 1 million in order to generate a sample weight. This is something that you can find online. The most important thing I want to stress here is that you cannot do any analysis using the DHS data without applying sample weight. And at step 8, you need to consider special values. Sometimes there are certain special values, the way variables are recoded, the way variables come in terms of the type of file that the variables come in, everything you need to really understand. And there are certain special values that are also in the data set. Like apart from the weight, we also have the country codes and other variables that are very, very important. You need to really consider them and really understand them when you are analyzing your data. So the step 8 is also very, very important. Now let's look at some standard recode files. When you are using the DHS data comes in different files, and you need to really understand each of these files before you use them. The first file is the household record file. And this is a particular data set that has one record for each household. So every household data is collected per household, not the individual members in the household, but the household together. So if you are about 3 and you constitute a household, there are certain variables or certain indicators that are collected for that particular household. In that case, when you are analyzing any data that has to do with the household in general, you need to use the household record file. The second standard record file is the household listing data. And the household listing data collects data from the household member. So one record for every household member. So assuming you are 3 in the house, the father, the mother, and 1 child, every person in the household data is collected on that individual. And when you are analyzing your data and then you are interested in knowing something about the specific individuals in the household, you need to use the household member record, or what we call the household listing data. The next type of record file is the individual women's data, or the individual record file. And this is one of the popular data sets of the DHS, because this data set has one record for every single eligible woman as defined by the household schedule. And here we are talking about women who are aged 15 to 49. So every individual woman, and because the reason why this data set is very popular is that it collects data on the woman as well as the child. So when you are talking about any issue related to women, and of course, we know that a lot of issues related to health are about women. So this is one of the popular data sets. And any eligible woman, whatever data is associated with that particular woman, data is collected on that individual. And of course, there are also men's data, or the male record file. And this data set has one record for every eligible man as defined by the household schedule. So here we are talking about men who are aged 15 to 59. The women are 15 to 49, and then the men here are talking about men who are considered to be in their reproductive period, who are 15 to 59. So the men's record file has a lot of issues about men, including the use of tobacco, including men's access to healthcare, including men's contraceptive usage. Just think about anything related to men, you will find something about it in the male record file. The next standard record file that is available in the DHS is the couples data. And here we are talking about the data set having one record for every couple. This is different from the men's and the women's file, because with the men's and women's file, we are collecting data for each of them separately. But here with the couples data, it has data for every couple. So the man and the woman together forming a couple, that is where we have the data set. So if we are talking about couples use of contraception, if we are talking about couple use of maybe access to healthcare or anything, you need to use the couples data and not the individual record files for men and women at the same time. The next widely used data set of the DHS is the children's data, or the children's record file. And this data set has one record for every child that is interviewed to women of reproductive age within the last 5 years. So we are talking about children that are less than 5 years. So here, any child of the mother that is less than 5 years, data is collected on that child from the mother. And that is a data set that is very, very important because we are not talking about all children here. We are talking about only children under 5. So once you are in a household as a woman and then you have a child that is under 5, data is collected on that child from you. And any individual that wants to analyze anything that relates to that child under 5 needs to use the children's recode file. The next recode file is the birth recode file. And this data set has one record for every child born to interviewed women of reproductive age. And let me let you know the difference between the children's data and the birth data. The children's data, we are only talking about children under 5. So if, for instance, they come to a household and then we have 2 children under 5, data is collected on only these 2 children. But the birth data or the birth record file is taking data for every child of the woman. If we have 5 children, if one of them is 6 years, 7 years, 8 years, whatever the age is, including those who are less than 5, data is collected on all these children. And the data is collected from the women. So if you are interested in, for instance, issues related to child mortality, you need to look at the birth record file because that will have data on all children that are born to the interviewed women. Apart from the standard recode files, we also have some associated recode files. And this is important because the associated recode files existed prior to some of the surveys. One of them is the wealth index data. So for instance, data that were collected in 1984, 1988, up to, let's say, 1998, a lot of the data sets don't have
I'll give you one inside.
A lot of them don't have the wealth index as a variable in it, in the standard recode files, but they have the wealth index as a separate data. So if we are using, for instance, the Ghana Demographic and Health Survey 1988, you may not find wealth index in that particular data set, but it doesn't mean that there is no wealth index. There's wealth index, but wealth index was collected as an associated recode file, separate one. So what you need to do is to merge that particular data set with the standard recode files for your analysis. Just recently, somebody did an analysis for a particular country, and then I think the person was looking at trend analysis. So the first data set was in 1984, and the person reported that there was no wealth index in the data set. When I saw it, I just realized that the person really doesn't understand the DHS, because any data that was collected from 1984, 1988, those ones still have wealth index, but they are not part of the standard recode files. So you need to really understand that wealth index was collected as a separate data and merge that data set before you do your analysis. Similar to wealth index, height and weight data were also not collected as part of the standard recode files until 1998. So any data that is collected before that period, 1988 up to 1998, for some countries, height and weight data are separate. And if you are interested in looking at issues related to height and weight, you need to merge that particular data set with the standard recode files before you can do your analysis. Apart from the standard recode files and their associated data, we also have additional standard files for the DHS 8, and this is only for countries that have DHS 8. One of them is the accident and injuries recode, and this one collects data on accidents and injuries for individuals within a household. This particular data set is available only in DHS 8. We also have pregnancies recode file. Anything related to pregnancy, now there's a separate file for that particular issue. So if, for instance, you are talking about mothers' pregnancy history, if we are interested in unintended pregnancies and other things, please check again to see whether you are supposed to use the individual recode file or the pregnancies recode file. Because if we are using DHS 8, a lot of the issues related to pregnancy would be in the pregnancies recode file and not the individual recode file. Similar to the pregnancy recode file, we also have the pregnancy and postnatal care recode file, which is the NR file. And this one also has data on indicators related to pregnancy and postnatal care. This is available in the individual recode file for DHS 7 and below. But in DHS 8, anything related to pregnancy and postnatal care, you would likely find it in the NR file. Then we also have the siblings recode household survey recode. And here we are talking about siblings of an individual. If we are interested in any issue related to siblings, you are likely to find it in the SR file. Then we have the child under 5 recode, which is the XR. And then finally, we have the field worker questionnaire. One of the things I need you to understand is that if we are going to do your analysis, the first thing for you to get to know, apart from the steps you have looked at, is to really understand which file is applicable for your study. Which file is applicable for your study. And to do that easily, you just have to visit the DHS statistics. We have a manual for the DHS, which is called the DHS statistics. You can also find the online link. On that link or in that manual, every file and the indicator associated with them, they are listed there. And it is important for you as an analyst or the first user of the DHS to really go to that website or just read the manual to understand which file am I supposed to use. I'm stressing on this because I've seen a lot of people, for instance, look at issues related to under 5 mortality or maybe issues related to a child under 5, and they are using the individual recode file. It can have the variables in the individual recode file, but that is not the right file you are supposed to use if we are talking about issues related to another 5 chart. You have to use the right file for the right analysis. And to do that, you have to just visit the DHS statistics, either the manual or the link, in order to understand which file you are supposed to use. Okay, so in conclusion, we have just looked at an overview of the DHS. I just tried as much as possible to make this as short as possible because I know there will be a lot of questions that may not be even related to the presentation. So if you have any doubt about the use of the DHS, or if you have any specific question related to what we have just discussed today, I'm happy to receive your questions. But in terms of conclusion, I would like to conclude that the DHS is a very, very important secondary data you can use. There are other secondary data, but I have been using the DHS for a very long time because it is user-friendly and it's one of the reliable demographic and secondary data that you can find. So once you are familiar with the DHS, it is something that you can use for any kind of project that you are interested in. And not only for publishing, you can use the DHS for your PhD. You can use the DHS for your master thesis. It's just giving a concept note or a proposal that is very convincing enough to your supervisors. And once they agree to that, you can use the DHS data set for anything that you are interested in. Thank you so much for your time and for listening to me. If you have any questions, I'm happy to take them. Thank you.
Thank you very much, Dr. Ahinkorah, for the beautiful presentation. So we have a couple of questions already and some hands that are raised. So let me just read the first question here. What pregnancy information is separately recorded in the GR code in DHS 8?
Okay. What pregnancy information is separately recorded? In the GR file, a lot of issues related to unintended pregnancy history of the woman, for DHS 8, a lot of them are in there, even though you can find them in the individual recode file, that is the IR file. You need to really go through the data set because I am not able to know exactly the specific questions that are asked and are in the GR file. But once you are interested in anything related to pregnancy, you can visit the GR file and a lot of the issues are there. But I know that the woman's pregnancy history is there, and you can also find issues related to unintended pregnancy. They are all in the GR file for DHS 8.
Okay, thank you very much. So someone was saying he was hoping you would spend more time on the analysis steps, especially the process of sample weights and formulation of research questions from the data.
Yeah, that is a good idea and a good suggestion. So when I was invited to speak on this, I told Doc that 40 minutes will really not be enough for such a rigorous discussion, because for a number of workshops you have had on the DHS, even the minimum time you have spent is about 2 hours, and 2 hours is for just an overview. The DHS, to be able to use it very well, after getting this overview, which is not even comprehensive enough, you need to, unless you understand the use of maybe a statistical software, you need to also be introduced to a statistical software. And once you understand a statistical software, the next step is how to do the analysis. And that can take about 4 separate workshops, I must say, because even just how to recode variables, how to generate sample weights, how to even do multi-level analysis properly using the DHS, the steps that are in the DHS, that is a workshop on its own. So unfortunately, we will not be able to really go into detail as to the steps in analyzing the data. But if, like I said, in the future, there is time for me to come and talk about DHS data analysis using a particular software, I'm happy to give you more details into that.
Thank you very much, Dr. Bright. Dr. Yesiru Karim, please unmute your microphone and ask your question.
Okay, good morning, everybody. So, can I be heard, please?
Yes, please.
Yes.
Okay. Thank you very much, Doc, for this very enlightening presentation. In the recent times, I've got to hear of the secondary analysis, particularly the DHS, and as a field epidemiologist, I think it's one to which I've got to be very much interested about. I must say that I was also thinking that you will talk a bit about the analysis, but like you have mentioned, the time is just not enough. Now, my question is this. I was going to ask you about the ethical issues surrounding using it for academic degrees, like getting a master's or a PhD, particularly in this part of the world, where people usually want to do your primary data, to go to the field, and to go to the rigorous process of data collection. So how can one fill in this gap to justify the use of a DHS for secondary data collection? Then secondly, I also want to confirm, I've seen people present on the analysis in the recent times, and I've noticed a particular lacuna. The gap is that sometimes when they talk about what they have gotten as data from the DHS, there are some gaps. For example, somebody presented around issues about like rabies, and then the information the person got from the DHS was, let me say, not enough for him. So there's some issues, gaps as regards some data. Can somebody now go to the field or to also add more primary data, or one must use exclusively whatever you have in that secondary data, and then you can put those problems as limitations? So I want to clarify this area. Thank you very much.
Okay, thank you very much. So in relation to using the DHS for your thesis, whether master's or PhD, the ethical issues surrounding that depends on how you acquire the data and your discussions with your supervisors. Because for instance, with my PhD, I did a purely primary data, but then in order for me to get a clear understanding of the issue I'm going to look at, I use the DHS. And I had to apply for access to the data sets. I have to also apply for ethical clearance from my university. even though I'm going to use secondary data, but they required that even the secondary data I'm going to use, I still need to apply for ethics. And this one is not like the normal ethics for primary data collection, but you need to show that the DHS also goes through an ethical process in order to collect the data. So there is evidence you need to present to the ethics committee, and they have to review it and give you an approval before you can use that particular data set for your analysis. So I must say that it depends on the institution and it depends on your supervisors. But I know that the DHS has followed a rigorous ethical process to collect their data. So you don't really need ethics approval like primary data in order to collect, to use the data. But to be able to use it, after you have applied to get access, you need to show that the DHS really went through that ethical process to collect their data, and I think that should be fine. The next question related to issues that are missing in the data set. Of course, the DHS doesn't collect data on every issue. So there are certain issues that you would not likely get in the DHS data. And that is a gap that you need to also fill with primary data if time will allow you. Because for instance, in relation to pregnancy, I looked at issues related to risk factors associated to pregnancy. And a lot of the issues that are in the data set are more about issues such as age, ethnicity, religion, and other things. There are no issues related to maybe access to healthcare related to pregnancy or even cultural factors that may be associated with pregnancy. So those ones are gaps that I had to fill with my actual primary data for my thesis. So of course, that is what you can do as a researcher. It's not everything that is in the data set, but you will be able to do the rest with primary data.
Thank you very much, Dr. Albright. Dr. Chinedu, over. Please ask your question.
Thank you for the presentation, Doctor. It was enlightening. Like someone has already emphasized, though, that because I was interested in the role or relevance of data analysis software in the analysis of secondary data, because I'm a bit familiar with the use of Stata, but I wanted to know if there are other softwares that can be used beyond Stata. And also, secondly, I wanted to know if there are courses that you can point us to. I know this may be going a little extra. If there are courses you can point us to with regards to getting more training in the analysis of secondary data. I know there are courses on YouTube, but as an authority in the area, you may know more. Thank you once again.
Okay. So I think with the software, apart from Stata, people use SPSS because the data set is also available in SPSS format. You can also use R programming. You can use R. You can import any data set from the DHS, whether it is in SPSS or it is in Stata, you can import it into R. And then you can do your analysis using R if you are familiar with it. But I know of SPSS straightforward. You can have the data set in SPSS format and you can get them in Stata as well. In terms of workshops, unfortunately, I think a lot of the workshops that are available when it comes to the use of secondary data are on YouTube, and for specific data sets like the DHS, when you go to the DHS website, there are specific workshops that are organized for people that are not familiar with the data set. And if you visit the website, I will be happy to share the link with you. Or even if you go to their YouTube channel, there are specific training about the use of the DHS or any other issue related to the DHS that have been uploaded on their YouTube channel. So there are quite a number of them, but probably you are interested in really analyzing the data. And if it is about the data analysis itself, then you need to visit a number of organizations that have training in relation to data analysis. But if you are familiar with Stata, like you have said, Stata also, when you visit Stata website, there are a lot of training about a lot of software packages in Stata that are available on their website. Stata organizes workshops and trainings. A lot of them are paid. A lot of them are paid, I must say. Some of them are free, but a lot of them are paid. That you can also follow in order to understand Stata very, very well. So probably you may have to check the various websites for the specific software packages, and they can guide you as to how to do your analysis using those softwares.
Thank you, Doctor.
Thank you. So we'll be taking some of the questions that were posted in the chat box before we take the next oral questions. Does DHS have data related to surgical problems, and are there country-specific data?
Surgical problem, I doubt, but the service provision, the SPA, could have some data in relation to the use of healthcare services, but not really on surgical issues. I doubt. From the experience I've had using the DHS, especially the standard recode files, I don't think there are any issues related to surgical in there. Probably you may have to look for a different secondary data, unfortunately, because the DHS, a lot of the issues in the DHS are more about issues related to reproduction. So reproductive health issues, sexual health issues are the major issues you are likely to find in the DHS, not any issue related to surgical issues. In terms of specific countries, we have over 90 countries that have the DHS. And I think some countries, unfortunately, don't have the DHS. And that one, I am not the right person to answer, because it could be for certain reasons why data is not collected for specific countries. So if you just want to know which countries the DHS covers, just visit the DHS website and you will see the list of the countries and their DHS. And if we are interested in knowing the countries that have the most recent survey, which is the DHS 8, I would also advise you or encourage you to visit the DHS website, because we have a list of African countries and non-African countries that have DHS 8. I can't give you the list here, but once you visit the DHS website, you will see all the list of countries with DHS 8.
Okay, thank you so much. So hopefully the next time Plus-Circle considers inviting you, maybe you can take us through the procedure for requesting data from DHS. Yeah, because that was pointed out as a request by one of the participants. Okay, and more than one person, actually, about 4 people. Okay, so someone is asking, does the DHS cover information about healthcare service utilization as an independent record? Did you get that? Hello, Dr. Ahinkorah? Okay, just a minute, please. I think he has some internet issues, but I'm sure he'll be back shortly. So we'll be communicating with the organizers, that's Plus-Circle Community Health Advancement Organization, based on some of the requests some of us have made on this call today. If Dr. Wright could be invited for one or more other sessions to cover the registration process, I'm sure that he would share the link to the DHS website before the end of today's session, so that we can start to familiarize ourselves with it before the next session where the organizers will be inviting him. So in that one or more of those next sessions, he may be taking the registration process, data analysis, merging of data sets, and maybe one or more of data analysis proper itself, so that we get to familiarize ourselves with the variables, the codes, and how to navigate the DHS. We understand that it's actually a somewhat technical thing to do, but with sufficient guidance from experts in the field, I'm sure we would find our way. And it's cost effective. Yes, we don't need to go to the field to do any data collection. We can sit from the comfort of our homes with our computers and with the software installed on it and proceed with the analysis. So we'd be glad to communicate with the organizers to bring Dr. Ahinkorah again. Okay. We are expecting him to return shortly.
I think he's back.
Yes, he is. Thank you. That's right. Can you hear us?
I'm on mute. I can hear you, sorry.
Perfect. Welcome back.
Thank you.
Okay, so let me please repeat the last question. It says,
Okay.
does the DHS cover information about healthcare service utilization as an independent record?
Yes. So it depends on what exactly you are looking for when it comes to healthcare service utilization. But I think the DHS has issues related to barriers to healthcare access, such as whether the woman has issues getting money for treatment, the woman has issues with the distance to the health facility, or any other issue related to probably access to contraception and other things. There are issues in there that are from the DHS. So it depends on the specific issue you are interested in, but there are a couple of issues related to healthcare access that are in the DHS.
Okay. Then what factors contribute to the lack of data in low-income countries? For instance, in Somalia, there is limited statistical information available.
I think it depends on a lot of factors because the DHS really follows a standardized approach for data collection. And there are certain countries that there are certain issues that are not collected from the country because either resources wouldn't allow or cultural factors wouldn't allow you to collect data on those issues. So if it has to do with Somalia, I really need to understand the context, what country dynamics were existing at the time of data collection before I will be able to know why this particular issue data was not collected on it. But I know there are certain specific country issues that may not really allow data to be collected on certain issues. And apart from that, there are certain issues that are not considered as global public health issues currently or global health issues currently in specific countries. For instance, when you talk about female genital mutilation, we have just a few countries that data is collected about that particular issue, including Kenya, Mali, and other countries, but not, for instance, a country like, let's say, Ghana, because FGM is not really an issue that is of public health interest in that particular country. So in that case, data wouldn't be collected for that indicator. So that could be the reason for certain missing data or missing indicators in specific countries.
Okay, thank you very much. Prince Sekpese, please unmute to ask your question. I hope I got
All right. The name is Prince Chekweche.
Okay.
All right. Dr. Bright, thank you very much for the presentation. I know you currently have an ongoing mentorship program for women. I personally shared a link with a friend of mine, and she's part of that mentorship program. I just want to find out when you will open application for your next intake for maybe with the guys also.
Okay,
Then
so go ahead.
And my second question is, in case I'm looking at malnutrition in children under 5, am I supposed to, and then maybe I'm looking at it among a particular group of women, maybe some age range, am I supposed to match the women data with the child's data?
Okay, so with your first question having to do with the REMS Consults mentorship program, and let me clarify that it's not only for women, it is for men and women. The reason why this year we opened acceptance or applications for only women was that a lot of women were missing. We didn't have a lot of women. And we really are interested in women because a lot of the opportunities have been given to men for a very long time. And for our mentorship program, as at that time, we had a lot of men in there. So specifically, we decided that for REMS Consult this year, we are only interested in women. But those who are part of the team knows that we have some men in there. And for next year, which we are going to call for invitation somewhere around March, I'm not really certain on the exact month, but I know it's going to be next year. It's going to be for everybody. That one is not women or men. Everybody can apply, but it's going to be a competitive process. So it's not as if when you apply, you qualify to become a mentee. Anu is part of our mentee, so she knows the process she went through before she became our mentee. So once the applications are out, I encourage men and women, everybody, irrespective of your age, you can apply. And then we would go through a screening process to select those we would want to be part of the team. Now, let me go to a specific question related to this presentation that has to do with the use of the DHS for analyzing malnutrition issue. For malnutrition, I think, or I am 100% sure that when you are interested in any issue related to malnutrition, and we are also interested in issues also in the KR file, that is the child under 5 file. So the KR file can be used for your analysis. You don't need to merge the IR file with the KR file before you can do your analysis. Every issue related to malnutrition, which is for the child, is in the KR. And then if you want to know about the woman's, it is also in the women's file. Because mind you, under 5 mortality data, under 5 data is collected from women. And before you can collect data on the child, you need to also ask the woman certain questions. So any question or indicator related to the woman is also in the KR file. So no need to do any merging. Just use the KR file and you are good to go.
Okay.
All right. Thank you very much.
Thank you, Dr. Wright. Okay, the next question says, does the DHS have a data analytics platform like Afrobarometer where users can do their own analytics across various rounds of surveys and countries? Did you get the question?
Okay. I don't think there's a platform like that. Yes, I got a question. Whether there's a platform that individuals can do their own analysis from multiple countries. Was that not a question? We don't
Yes,
have
that was it.
a platform like that for the DHS. Okay, we don't have a platform like that for the DHS. If we want to do multiple country analysis, you need to download the data set for every individual country. Then you append the data set to do your analysis. You go through a lot of variable selection, screening, merging files, selecting variables, recoding to make sure each data set for each specific country has all the variables you have before you append the data set to do your analysis. That is the only way you can do your analysis for multiple countries. But if you want a platform, you can explore various indicators. Then I think the DHS has a platform, which is is it the DHS? Sorry, I just forgot the name. Let me just look at that. Okay, so that is the Start Compiler. So the Start Compiler is a platform that you can really have access to a number of issues, indicators about the DHS, and you can look at the specific country issues for specific countries. And if you're interested in Africa or other low and middle income countries, you can have all of them. The Start Compiler really doesn't give you any specific analysis. You can only explore how various indicators are across countries, but you cannot present that in an article or a manuscript for what you call publication. What you need to do is to really do the analysis yourself. So that is how the DHS unfortunately comes. It doesn't come like a platform like the Global Burden of Diseases or any other platform that has the data available for the analysis.
Okay, Thank you very much. Mrs. Bisola Olubi, please ask your question.
Thank you very much for this insightful presentation. My question is, I just wanted to clarify if everything that you have talked about regarding DHS applies to MIS as well. Because for those of us that are interested in exploring, questions around malaria in children, I don't know if the files are organized in the same way. For instance, if we are analyzing malaria in children, are there extra files regarding wealth index, household variables, like if you want to look at maybe household distance from waste sources, water source, and all of those things? Are there extra files, just like the DHS for the MIS as well? Thank you.
So a lot of the standard recode files, like the individual recode file, the under 5 recode file, the birth record, and other things are more related to the standard recode files for the actual DHS, that is the standard demographic and health survey, and not the malaria indicator survey. But the malaria indicator survey comes as a file on its own with other multiple files for certain countries. So that if we're interested in issues related to malaria for the child, for instance, or the mother, they are all in one file. You don't need specific file for maybe couples or specific file for maybe household members, like the standard recode files for the actual DHS. So the malaria indicator survey also has its own data sets that you need to look at. But a lot of the issues, like how to apply sample weights, like how the variables are measured in terms of they are collected for each of the data sets, those ones are applicable to all the standard recode files, including the DHS and then the malaria indicator survey as well. So you'll find all the issues also in there. But if we're interested in any issue related to malaria, even though there are some of them in the individual recode files for the actual DHS, you can, or you have to use the malaria indicator survey, which you talked about.
Okay, thank you. For the wealth index variable, you mentioned that the data needed to be merged before the analysis. Could you please clarify which type of database or data sets are required for this merging process?
Okay, so I only mentioned that the data set need to be merged for some countries, especially those for data that are collected very old data sets. So that was what I said. So for instance, if we are working with Ghana Demographic and Health Survey 1988, and you are interested in the individual recode file, you need to merge the wealth index data with that particular data set. And merge depending on the software you are using. If we are using, for instance, data, you can just do merge one-on-one, many to one, whatever way you want to do the merge. It's just a standard approach to merge data sets. And the step depends on the software you are using. So I would say that, yes, of course, when you are using a data set where you need to merge the data with another file, then you have to follow the process of the software you are using in order to do the merging.
All right. For data presentation.
Did I answer you correctly?
Yes, I think you did.
Okay.
Yeah. For data presentation in the frequency table, that is descriptive analysis, do you recommend or put the non-applicable or number of missing responses for number of visits and timing for first antenatal clinic visits as no visit or 0 visits, since the DHS guidelines indicate that those missing or not applicable must be part of the denominator? I think he's referring to the kids record data sets.
Okay, so how to treat medicine in general with the DHS depends on the indicator you are interested in. That is why I mentioned earlier that there is the need for you to look at the manual as well as the questionnaire. There are some missings that you cannot recode and include them in the data analysis. They have to be missing, which are missing not at random. So if they are not missing at random, it means that for some of them, you have to drop them. So we have a way of dropping missings. But for some of the missings, if they are supposed to be part of the denominator, then you are supposed to use them as part of the data set. And in that case, you don't have to code them as separate missing. You have to add them to a certain category of the variables you are interested in. And all of them are steps that you have to follow. There are ways to do that, but like I'm saying, if we are using, for instance, data, there's a way of missing to a particular category of an indicator or variable. But without us doing the actual analysis, it's difficult for me to show you exactly how to include that in your analysis. But if you have treated it as missing and you have created a separate category for the missing, then you can present it in your descriptive table when you are doing your frequency table presentation. It is also allowed, and you have to report it as such and put a note down to show that this was missing, that was part of the data.
Thank you. Is DHS data linked to GPS information, thereby enabling spatial analysis?
That follow me on LinkedIn, just recently I posted a workshop that the DHS is organizing for people that are not familiar with GPS. The use of spatial analysis. The DHS has a spatial component, and you can easily find that on their website, as well as attending the workshop that I shared. You can easily visit this link, and you should be able to understand anything that relates to spatial analysis using the DHS. Let me share the link here for everybody. Yes, so this is the link. Any data that is spatial, you can visit that link and you understand how to use the DHS for that. And with spatial analysis, there are some spatial packages. You don't need to know about any spatial software. Sometimes if you are interested in just generating spatial map for a particular country, there are some codes in, let's say, Stata or even SPSS that you can run in order to get some spatial map that is representative of what you are interested in. And that is also available in the DHS.
Okay. Which of the DHS files can I use for under 5 mortality?
Okay, so under 5 mortality, anything related to the child, if you are interested in mortality issues, the recommended file that you are supposed to use is the child recode file, which is the BR file. That is very, very important. Even though under 5 mortality, we are talking about children under 5, but anything related to mortality, death of the child, the BR file is the one that is recommended. So you have supposed to use that and restrict the analysis to only children under .
Hello, Dr. Bright. Dr. Ahinkorah, are you still here? Okay.
Yeah, I'm here. I can hear you.
Okay, good. All right, Dr. Oyetola, I believe Dr. Ahinkorah has responded to your question on additional courses. Okay, so there's a question here that says, please. Okay, it says, please, who answers the questions in the couple's data? Is it one of the partners or both? What happens if the response of one partner differs from the other? Maybe if you can give an example or two of questions asked under couples data, it can shed more light. Thank you.
Sorry, my line cut again. Hello, Anu, can you hear me?
Yes, I can.
Did I miss the question? Did I miss any question?
Okay, so I read the question, but I would read it again. Please, who answers the questions in the
Okay.
couple's data? Who answers the questions in the couple's data? Is it one of the partners or both? What happens if the response
Any?
of one partner
Okay.
differs from the other? Probably you can give an example or two of questions asked under couple's data. It may shed more light.
Okay, so usually it depends on who is available at the time of data collection. So if the father or the husband is available, the husband is asked the question. If the woman is available, the woman is asked the question. If all of them are available, then all of them can answer the question, either as individuals or separately. What happens with couples data collection is sometimes it depends on the country, because there are certain countries that the men are supposed to answer because a woman cannot when the man is at the house. So the person that is collecting the data will obviously collect the data from the man as the head of the family, if I should put it that way. But if the man is not available and the woman is available, the woman answers for all of them. And if the two of them are available, the two of them answer as a couple. So all of them together answering the same question as a couple. So for instance, a question related to couples can be couples' use of contraception, couples' intention to give birth, couples' access to healthcare services. There are questions that are related to couple, and the couple are supposed to answer as one individual and not a separate individual. There are a lot of questions about couples that are in the couples recode file. I've just given you examples, but when you visit the actual data set, you will see a lot of questions that even though they are collected from them as individuals, but they are also collected from them as couple. Why couple data? The couple is important because some in the couple's issues related to the child. If the couples are having issues with access to healthcare, how does it affect the child as an individual? That is where you are interested in that. For instance, sometimes you are also interested in, let's say, couples' use of contraception or barriers to contraception uses, And all those issues are collected among couple in order for you to understand them very well and not at the individual level. So that is how data is collected from couples for the DHS.
All right, thank you, Dr. Bright. I understand that DHS is often approved by a country's ethics review committee. Do you, by all standards, require ethical approval for using the data for a journal paper?
No, you don't need ethics approval from anybody for a journal publication. The DHS already goes through ethics to collect its data. And like you mentioned, every country uses the specific country ethics committee or ethics approval board in order to get access or collect data for the DHS. So when you go to Ghana Ethics Review Committee, for instance, would give approval to collect the DHS data. So once I'm going to use Ghana DHS for my analysis, I only need to apply for access to the data. And one other thing I need to emphasize here is that for ethical reasons, that is why you are not supposed to share the data set with any other person apart from you who was granted access to the data. So if you applied and got access, even though the data, once it comes to your laptop, you can give it to another person and the person doesn't have to go through the application process. For ethical reasons, you don't have to do that. And if you are using the data set for a particular project, for ethical reasons, for instance, if I am using the data set for and I have got access to the, let's say, BR file, and I'm using the BR file. And of course, sometimes they don't even give you only the BR file. They will give you the individual recode file and all the other data sets. But you applied and said you are going to do under 5 mortality, which is the BR file. Then you go and use the same data set to go and do teenage pregnancy. It is ethically not correct Because if we're interested in teenage pregnancy, you need to apply for access to the data set. Sometimes it's difficult because you have applied and you already have the data set on your laptop. Why do I have to apply again? But then one of the things that a lot of journals will require is that going forward to provide ethics approval for the use of the DHS, you need to show that you applied and got access to the data. Because getting access to the data is obviously one of the ethical issues you need to comply with. So for any project you are interested in, apply for approval and get access to the data, ethics approval from any other organization in order to use the data set for any project.
All right. The problem I usually face is some components or variables are missing in some countries' data when I try to pull data across multiple countries. For instance, components of antenatal and postnatal care vary among countries. How do I deal with this?
Unfortunately, sometimes when there are certain components that are missing from a particular country's data set, there is little you can do. And that is one of the challenges with the use of data, especially the DHS when you are doing multiple country analysis. You only have to do with what you have. And if the variable is missing in a particular country, what I would do as an analyst is that if, for instance, I'm dealing with 20 countries and the variable is not present in, let's say, 5 countries, I would obviously drop those 5 countries and concentrate 15 countries that have all the variables. One other thing you can do is to drop that particular variable. If, let's say, just one variable is something that is missing from quite a number of the country's data sets, and you think without that particular variable, you can still do your analysis, then the best thing is to drop the variable. But if you think that variable is very, very important, you cannot do away with it, then the countries that don't have the data set, you can decide to drop those countries and focus on the ones that have the data set.
All right. Thank you very much. Okay, so let me go to the next question. Where can we go to access information on the mentorship program? I believe Dr. Bright has responded to that. It would be published next year, and the application process would be competitive, like emphasized. Well, I'm sure Dr. Bright would also share it on his LinkedIn page when the call is open, right, Dr. Bright?
Yeah, I will, of course.
So you can do well to follow him as you follow Plus-Circle. Okay. Now from Isaac Mensah, I see a lot of overlaps in the recode files. As a novice user of the DHS, conducting research involves children under 5. Which of the recode files do I use? Is it the woman recode file, which covers data on the mother and the child and the children under 5, or the children recode file? And why would one recode file be advantageous to use than the other?
Okay. Can you repeat what indicator is the person interested in?
Well, he didn't mention the indicator, but let me read the question again. Seems he wants to conduct research involving under 5
please
children.
repeat.
Research involving under 5 children.
Under 5 children, okay.
Yes. So he's saying which of the record files does he need to use? Is it the women record file or the children record file? And why would one record
obviously if it is about
just over the other?
Okay, so if it is about children under 5, then of course the KR file, that is the children's record file, is the only one we can use. There are no advantages, I must say, there are no advantages of one record file over another. The only thing is that one record file cannot be used for doing something that is not related to that particular file. For instance, you cannot use the IR file to look at under 5 issues when there is KR file. Technically, the DHS, even though you may have some of the issues for under 5 children in the IR file. If you use it, it doesn't make you a good user of the DHS. It means you don't really know about the DHS. Let's, for instance, talk about vaccination. Vaccination questions are asked of women as individuals, and it is some of the questions are in the individual recode files. But the DHS recommends that if we are talking about vaccinations, you have to use the children's recode file, that is the KR file. So as somebody who has been using the DHS, there's no way I will go and use the IR file instead of the KR file for vaccination issues if I'm talking about children under 5. So the best thing you need to understand is that whatever file you are supposed to use depends on what issues you are interested in. And there are no advantages of one over another, but there are specific files that are supposed to be used for specific issues. That is why I mentioned that in order to know which file you are supposed to use, just go to the DHS statistics. It will tell you that for this indicator, use this file. And that is the only way you can make good use of the DHS.
All right. So we'll take the last few questions. And someone is asking that, do we apply sample weights to all variables or just some variables?
All variables. All sample weight for variables. When you are doing your analysis using the DHS, whatever indicator you are interested in, sample weights, very, very important. You cannot do away with it. Whatever analysis you are doing, whether you are doing descriptive analysis, whether you are doing chi-square test, multi-level analysis, regression analysis, you need to use sample weights. If you don't use it, you are doing a wrong analysis, and that is not recommended of the DHS. In terms of, yes, the workshop about the mentorship program, those of you who have not already followed my page on LinkedIn, this is my profile. You can follow me and follow the associated organization, which is REMS Consult. And any issue related to that particular workshop or that particular mentorship program, you put it on this page and you are happy to apply.
Okay. Sometimes mini DHS are reported. Are they very different from the full DHS data? If yes, what is missing in the mini DHS data sets?
Okay, that is why we call it mini. The mini DHS are often collected prior to the actual data set, but it's only specific to certain countries. So for instance, Ethiopia has mini DHS. We also have some for Senegal and some few other countries. Sometimes they are not able to collect everything because of time constraints, or they don't even have resources to collect everything. So they collect a mini data maybe 2 years or 3 or 4 years prior to the actual data collection, which is the actual survey. And that doesn't have every issue related to the standard demographic and health survey. There will be 1 or 2 issues that are missing in the mini DHS compared to the actual DHS. But if you want to really know what is missing and what is included, then you need to look at, for instance, Ethiopia DHS and check the actual DHS and then the mini DHS to see whether something is missing. But of course, I know that there will be some of them that are missing in the mini and not the actual DHS. So if you want to have a look at that, you can do that and see.
Okay, so this question is from Dr. Antaiwo, and it says, under what condition is data on contraceptive use collected from women and girls? Under what condition is data on contraceptive use collected from women and girls? Who gives approval for participation? And how is auditory privacy maintained in the household setting during the interview?
Okay, so when we talk about contraceptive usage, with the DHS, data is collected on only women of reproductive age. And when we talk about girls here, I'm not really sure what exactly you mean by girls, but with the DHS, anybody that is age 15 up to 49 is considered as a woman of reproductive age. And that person is considered as old enough to answer questions related to reproduction. So contraceptive usage if we are 15 years, there are no ethical issues. There are nothing wrong with a girl who is 15 years answering question in the household, because it is allowed that that person is considered as matured enough to answer questions related to reproduction. So when we come to your household and you have a girl who is 15 years and the mother is 45, and they are asking questions about reproduction, including contraceptive usage, they will ask the child 15 years and above, as well as the mother. And if the mother needs to give consent, especially in some countries where it is only considered appropriate for children who are 18 years and above to answer questions on their own or to become independent, then we seek consent from the mother or maybe the parent, if I should put it that way. But with that, because DHS already has consent forms and other things, I think the only thing they will seek is the assent form. So they will give the woman or the mother or the father an assent form to assent to the consent of the girl who is 15 years, 16 years, 17 years, in order for the person to participate in the data collection. And I don't think there are any legal issues around somebody who is 15 years up to 17 or 18 answering questions related to contraception.
Okay, so just a follow-on to that question. So
Okay.
for auditory privacy, how do we manage, or how has it been managed during the data collection exercise?
Okay,
Especially for
so
the adolescents.
privacy, yeah, so it depends on what happens in the home. As with any primary data, for instance, I did my study on adolescent pregnancy and it was among adolescents. So when I enter a household, what I do is that after I've sought for approval from the mother, I would ask the mother to look for a place that is convenient for us to conduct the interview, or maybe for me to administer the questionnaire. If it is in their hall or even if it is at their backyard, I go there and then I answer the question. I ask the person the question. The woman or the mother or the father don't have to be present when they are collecting the data on the adolescent. Once you have sought for their permission and you have been given approval or permission to do that, then I'm sure that they can give you a convenient place to collect the data from the adolescent without any legal issues. And there are no issues with somebody's presence there. Of course, nobody will be there to influence the answers.
Okay, thank you. Assuming that my analysis focuses on vaccination, which data set would be ideal? Birth record or kids record?
The kids record, the K alpha, is for vaccination issues because that is for specific children who are under 5. A lot of the issues related to vaccinations are children under 5. So you cannot use the B alpha because the B alpha contains data on children that are above 5 years. So the best data set you are recommended to use which is the
Okay, thank you. So Dr. Maxwell Noah, Plus-CircleCo has not organized any previous training on manipulating DHS data, but this is something we will consider. Dr. Wright and other colleagues on this call have shared some resources which you can click the link to accessing their contents, okay? Right. Yes, we'll be sharing the recording shortly after the session. We would share the recording to the session. Okay, I think this is the last question. Is it advisable to use secondary data where you may not get all the demographic information? For example, a colleague wants to work on a trend of diabetes among adolescents in some selected regions in Ghana by extracting the data from the DHMIS2. The only demographic information available are the ages and sex. In such a situation, is it laudable to work on the available demographics only?
It depends on the kind of analysis you are doing, but there's something we call data linkage. Sometimes you can link a particular data with another one. If
We can't hear you any longer, Dr. Bright.
Sorry, can you hear me?
Yes, please. We can.
Okay, you can. Good. Thank you. Sorry for that. So what I was saying is that the District Health Information Management System data, that is the DIMS, may have certain issues on diabetes you are interested in. And you may also have some data related to other issues in the DHS. We have something we call DH. You can link the two data using any software you are using in order to have the data sets together and use them for your analysis. I don't think it's advisable for you to only use available demographic information in a particular data set because it's difficult to find all the demographic issues. The other thing you can do is that if you think the DHS doesn't have a lot of the demographic information you are interested in, then you don't use the DHS at all because there are certain indicators that are not there and there's nothing you can do about it. But if you know how to link data sets, then that is the best way you can do your analysis.
Okay. Dr. Bisola Olubi, your hand is still up. Is it a new hand or the old hand? Okay. All right. Thank you so much, Dr. Bright Opoku Ahinkorah. We appreciate it. It's been an exciting session learning from you, DHS Guru. Yes, thank you. So, as mentioned,
All right. Thank you.
Plus-Circle Community Health Advancement Organization would consider inviting Dr. Bright another time to deal with one or more of the requests or issues we've raised. So please look forward to receiving an email notification of that and when it would be from us. Okay? So we implore you to kindly follow us on our social media platforms, especially LinkedIn and YouTube, where you have access to timely information and all the previous recordings.
Excuse, I have a question.
But you didn't raise your hand.
Hello, moderator.
Hello, Dr. Silvanus Welle.
Yes, can you forward some of those links to our emails because you display some links and then you within seconds you remove them. Can you forward them to our emails?
That's not a problem. We will. But I've shared it again on the chat box. Yes. So, especially for the YouTube session, the link to the YouTube page, it has all the previous video recordings. So you can do well to take a look at it and watch the one that best resonates with you. But all of them contain very useful information. Right. So with this, we have come to the end of today's session. Dr. Bright, again, we know you are a very, very busy person. And thank you very much for deeming it fit to be on this platform with us this morning. It's morning in Nigeria and morning in Ghana. Yeah. So thank you very much. It's been a pleasure learning from you and drawing from your wealth of experience. We look forward to having you on this call another time. And we are sure that you would be glad to join us again. Thank you so much. So, dear participants, as we've learned today, please let's use the link so that we update our knowledge and we familiarize ourselves with the DHS details ahead of the next session, whenever it will be holding. Okay? But please look forward to further communication from us. Another session, which may or may not be related to DHS, will be holding next week, Saturday, 8 a.m. Nigerian time. And we look forward to having you on future conversations. Please tell a friend to tell a friend to tell another friend. It will be worth your time. Thank you so much, everyone. Please have a very good weekend. Bye.
All right. Thank you. Bye.